I've been looking at this whole issue of genetically modified food for the last 5 years because what is happening is that our bodies have been subjected to high levels of toxicity from various sources which were not really naturally indicated. The American, I forget the name of the Association of Doctors, medical practitioners, have advised all patients to get onto a GM-free diet because 4 major crops in USA are corn, cotton, soya, and canola, have been now 90%, 80% genetically modified. They are finding that gut-related illnesses in USA have sharply increased after the introduction of GM food. They are finding that there's a whole body of research coming out on linkages with immune system, allergy, autism, Alzheimer's, cancer, and so on, which is being strongly refuted by the GM industry. And it's like the tobacco battle. It'll take 50 years, 60 years, 100 years, I don't know how long, before the regulators and the industry will accept that there are linkages. So the question I want to ask you is that have you gone into this in any depth? Do you think this is correct, what is being said?
I absolutely 100% believe that this is a significant portion of the problem. There is a saying that I tell my patients when I first meet them, you are what you eat. Food is the first medicine. And when food has been messed with, that's the medical word using messed with, when food has been messed with genetically modified food, you are messing with the immune system because the immune system over evolution has been trained to respond to certain proteins in certain ways. And when you suddenly change their structure because you want the crop to grow faster, you don't want diseases and pests to catch it, you don't want to do 10 other things, you do modify it. So a very big part of the therapies that we do with our patients, and I have spent a good 10 plus years with some of my team members going to remote parts of India, Nepal and other regions, trying to identify places from where we can still get food that hasn't been modified, because the reality is that everything that gets refuted, rejected from Europe and US gets dumped in India. And we are never told about it because the regulation is very weak here for those things. Whether you look at drugs, whether you look at, it takes a long time for some of those things to come here. And so it's already happening in our system, and this is just one portion of the problem. So even when we talk of organic food in America, the regulation is that it has to be 40% organic. The remaining 60% can be anything else and you can get a label for organic food. To me, that is not organic food. And they have FDA approved things written on them.
Sitesh, just to make it short, because I think we all know genetically modified food, and now, like idiots in India, we want to even do the bananas and brinjals and all. I think this story about, I'm very happy that you went into it, just like Gerson's Institute in California, which you must be aware of, been there for a long time, in the wheat belly, which has been written by Michael Davis, Dr. Michael Davis from Milwaukee. I think 65 years back, there was nothing like gluten allergy. But because of genetically modified wheat, one after the other, we have developed this genetic and immuno problems. But what I want to say, food is one aspect, very, very important over the years, but I think it's a psycho, neuro, endocrinology, the whole axis, the new science, which was established in '85. And all of us know now, as you said, that this holistic approach is very important. I'm a gynecologist, so I'm aware of things and I know what is what. We get a very good chance because of antenatal period of 9 months to interact with our patients. But what I'm trying to tell you is that the most important thing about what you said, that 10 to 15% are willing to go through this improvement. Are you able to get the results? And what is your approach like? Is it multifocal? You are doing everything, like psychological, emotional. So team consists of what? Which people? The specialist in each aspect?
So It's interesting you mentioned psychoneuroimmunology because one of the first textbook articles on this topic in America ever written in the textbook of psychoneuroimmunology on stress and allergic diseases I wrote with my research mentor about 6 years ago. And the topic of the textbook article was stress and allergic diseases. We tied in everything because maternal stress has been tied in with childhood asthma, childhood
Of course,
allergies, eczema.
everything.
It's really fascinating.
It's a
This is
fetal
all
origin of
connected.
adult disease.
Exactly.
It's a fetal
So
origin.
we start in terms of how we approach these patients in those 10 to 15%. Yes, our approach is encompassing everything. So we look at the physical disease and whatever it will take in terms of treatment. We look at the mental or psychological aspect, and I have been fortunate to connect with the right kind of people at the right time in my life who are excellent counselors. I don't always look for people who necessarily have degrees. I look at the results that they produce, because I've come to realize that it's not always the degree that matters, it's whether the person has ability to connect with the one who's in front of them and be able to produce the results that I'm looking for. So not everyone on my team necessarily is a doctor, is
But
what
you
I'm
can-
trying to
I
say.
think you are happy. You are very lucky because you're in India, you can do it.
We do diet, we do lifestyle, we do social, emotional, psychological, spiritual, all aspects of counseling, all aspects of treatment, all the way to prayer and meditation. If a person requires that for their healing, everything is done.